Hello, I'm Dr. Inman. This is a mini lecture on aggression in the canine, essentially this so-called mean dog syndrome. These are animals that are openly and actively aggressive, essentially, especially young animals. We've found that there were dogs in around 8 or 9 months that were just vicious. Essentially, we tried to handle them, and they're basically fighting like they're fighting for their life. They're not biting or nipping, they're biting to tear and also injure, because they're trying to defend themselves. The interesting thing about these animals, essentially, even when they get older too, because we can see this up to 5 to 6 years, is we find that these animals have a vertebral subluxation complex at their atlanto-occipital area on the left side. Now, this doesn't make sense. The most common subluxation problem, vertebral subluxation problem in Reed that we find is the right atlanto-occipital area, this area on the side of the neck, on the side. But the one that we're talking about here that we find unusually is the left side. Now, you're going to ask me why the left side and essentially why that occurs, and we don't really have a good answer. However, we have suggested in the past that these animals have been injured in the birth canal, because usually it's a big fat-headed puppy, one of the first or second puppies that are whelped from the first whelping of the female dog, essentially, and we think that they're compromised as they come out of the actual birth canal. And so the wings of the atlas here, where this side of the head is right here, this side of the head basically is the normal subluxation that we find, but this is the one that basically seems to hold that problem in place. Now, the good news is that we can in fact treat these animals effectively with this therapy, and their aggressive behavior goes away. It is suggested that these animals are aggressive because they're in pain. It's kind of like having a migraine headache from the day you're born until forever. That doesn't ever stop. The animals kind of get used to it, but they have a hair trigger, and so anything that's going to cause them an acute exacerbation of this pain causes them to go into flight or fight mode. We also will utilize frequency of sympathetic overstimulation, because these animals are cranked sympathetically all the time because of chronic pain, and what we'll endeavor to do with these animals is we'll use a set of frequencies that are designed to try to overstimulate the sympathetic nervous system with 216 cycles per second, along with some others. We show this in detail in the advanced and basic laser modules on bombtech.com. I'd have you go there and we can show you what that looks like. But what happens is we'll be able to laser this particular area, but also we want to reset the animal's autonomic nervous system that is cranked to the max due to chronic pain. We not only will use 216 cycles per second, but also when we're done with that, for after 180 seconds or 120 seconds, is we'll go to the parasympathetic nervous system with 240 cycles per second, which will reset the parasympathetics. And so what we're doing is we're overstimulating the sympathetics, which go up for a while, and then after about 30 seconds they come back down to normal, allowing the parasympathetic to come back up. And then also we're stimulating the parasympathetic to drive it back up to its maximum setting. A parasympathetically derived system is a happy, healthy dog that likes to sleep, take naps, likes to play, and isn't continually stressed out. So we have been able to take care of aggression in the canine with this type of approach. It isn't a fail-safe situation. A lot of times we're presented with these dogs after they've bitten a child. Now, a lot of people will suggest a dog that bites a child is a dead dog. I come from that category 1,000 years ago. However, people are reluctant to put their beloved dog to sleep just because he chomped the next door neighbor. However, they're going to have to do something. So we'll get these dogs to us, and we'll go through this particular cycle, and we get them fixed, and that's fine. However, a dog that chomps a kid, essentially, and that is aggressively biting, is never to be trusted again. So we want to make sure that there's legal aspects of fixing these animals. If you declare that the animal repaired and fixed, and the animal goes out and chomps the next door neighbor again because it's good sport, then all of a sudden you get sued. So my advice would be to be very careful with these animals and treat these animals with a caveat that they're never to be trusted again. Thank you, and have a great day.